Hey guys, Pam here, and well, Lena. I just wanted to make a video and post it. I haven't done an update in quite a while. Most of you, if you are my Facebook friend, if you are my Facebook friend, you'll know that I have received my surgery date, and I am absolutely thrilled about it. Couldn't be more excited. It is July 2nd. You have to say, this whole process took a lot longer than I thought it would. All in all, it took 7 months, which, you know, if you're in the United States or in the United Kingdom, that seems really rather short. But for Switzerland, I do think it took a lot longer than I had anticipated that it would. And I think the reason for that is one in part to the psychology department of the University of Zurich's hospital is just overwhelmed. Too many people there, too many patients that are needing appointments, and it took quite a while to get that appointment. And the other problem for me was that my endocrinologist, who was organizing and kind of spearheading all of the preoperative testing, he passed away. So that was rather, it really was a drawback. It slowed things down quite a bit. I have to say my new endocrinologist, however, was really on the ball, got things moving quite quickly, and I appreciate that. So yeah, I am scheduled for July 2nd. I'm really excited because my mother is coming. She is flying in on the 29th of June and will be here until the 10th of July. So that is exciting news for me just to have her here. I am somewhat nervous. I got the preoperative paperwork from the hospital in the mail the other day, and it stated that the anticipated hospital stay is 7 days, which is drastically longer than anything in the United States, and I'm assuming in the UK as well. It's just not something that I'm looking forward to. I hope that I am able to convince them to let me go after 2 or 3 days at the most, because the thought of spending 7 days in hospital is just, bleh. No, thank you. So we'll have to wait and see how that goes. I have one more appointment. It is a appointment with the anesthesiologist. It is on the 12th of June. I have a meeting with him, or an appointment with him, I guess, to discuss everything regarding the anesthesia with the appointment. Other than that, I am all set. In one way, it is quite different to the stories that I've read and the videos that I've watched of people who are stateside. I do not have to be on any type of preoperative diet. I don't have to lose any weight. I haven't even met with a nutritionist yet. All of that takes place in the hospital after the surgery. So it's been really interesting. The only preoperative information I was given was a 1-page front and back handout, so to speak, with some information about risks involved with the surgery itself and the bypass specifically. So, and of course, we discussed all those risks and scenarios in my appointment with the surgeon a couple of weeks ago. So I think I have a complete understanding of some of the risks that are related to this specific procedure. I did, in the end, decide that I was going to do the gastric bypass and not the vertical gastric sleeve. For me, that decision was simply put, it just came down to the fact that my surgeon recommended, he said it was still my decision, but he would recommend the bypass. And I just thought, you know, if he is suggesting that for me, then I should follow his counsel. So that's what I have done. So that's pretty much it. I'm really excited. I wish I had more information. I wish I understood a little more about what is gonna happen after the surgery. But I guess it's just one of these things where you live and learn, and I will just, figure it all out as I go along. And that sounds a bit scary for someone like me. I like to know the ins and outs of everything, but yeah, well, we'll just see what happens. Other than that, there's really not much news. I continue to, I have to say, every morning I get up, I am really grateful that I am about to have this surgery. I have come to a point where a change is necessary. I am miserable in this body. I am miserable getting dressed in the morning. I am miserable when I have to move around and my body gets in the way of me. It's just no easier way to explain that than it gets in the way of my movements. I mean, I feel constricted, like I am stuck inside a fat suit, and it is definitely time for that to change. So I am really just so grateful and feel so blessed that the insurance here in Switzerland covers this, and that it's not as difficult as it is back home to get that covered. I'm also grateful that if it so happens that I will have this extra saggy skin that needs to be removed, that is also something that the insurance will cover, which is, I realize how incredibly fortunate I would be if that's the case, compared to those of you who have done all this hard work and you have that skin and there's just no chance of getting it removed without, paying thousands and thousands of dollars out of pocket. So I definitely realize how fortunate I am. So yeah, I mean, for all of those of you out there who are at the beginning of your journey, best of luck. I can say that it's exciting every day as you're waiting for these preoperative appointments, and you're kind of wading your way through all this information. It's exciting and nerve-wracking at the same time, but I know it's going to be absolutely worth it. So yeah, I think I'll make another video the morning of my surgery, or maybe the night before, and then I will see you guys post-op. Good luck on your journey. Take care of yourselves. Let me know if you have any questions, comments about the procedure here in Switzerland. I'm sure that there's others who might be here, expats or even Swiss citizens who are interested in the process of how it works. So if I can answer any question for you, please let me know. Take care of yourselves.